Kia ora koutou everybody, good afternoon. Let's start again with the good news today, as we always do, around our vaccine rollout program. As of late yesterday afternoon, we have reached another milestone in our rollout of the COVID-19 Pfizer vaccine. 500,000 New Zealanders have now received their second shot of the vaccine, meaning that they are fully vaccinated as part of our campaign. It's a significant milestone towards our work to ensure that everybody here in New Zealand is protected. It is a tangible evidence of the progress that we're making to get the vaccine rolled out. A month ago, we'd fully vaccinated around 250,000 New Zealanders, so doubling that number demonstrates how the rollout has been gathering pace. Another piece of good news I am happy to share today is that the Janssen vaccination has now been approved by MedSafe. It's been granted its provisional approval for individuals aged 18 years and over. I'll expand a little bit more on that shortly. And of course, earlier this week, we did receive the biggest delivery that we have had to date of the Pfizer vaccine, 150,000 doses arriving in New Zealand as part of our big deliveries that we're expecting through the month of July. So all of this means that I am confident, the government is confident, and indeed New Zealanders can be confident that our vaccine rollout is ramping up and gaining pace. That confidence continues to be reflected in the weekly figures that are being released on the Ministry of Health website right about now. So as of midnight last night, more than 1.27 million doses of the vaccine have been administered across New Zealand, an increase of more than 120,000 doses on last week. With more than 760,000 New Zealanders have now received at least one dose of the vaccine, and 500,000 have received their second dose. We're making good progress in groups 3. In the last 7 days, we've administered 49,000 Group 3 vaccinations. Overall, DHBs track about 6% ahead of plan, slightly down on where they had been before. Consistently mindful that, as I know they are, of the tight delivery schedules. As more vaccines start to arrive in bigger quantities, they will be able to fill up more smoothly. For a little bit more context on the Janssen vaccine approval, we had previously announced that we have secured 2 million doses of that vaccine through our advanced purchase agreement last year. At that time, we purchased a portfolio of vaccine options to provide us with flexibility, so today's MedSafe approval is very welcome news. Formal gazetting of the Janssen approval took place about half an hour ago, and it follows MedSafe's very rigorous assessment process, informed by the most up-to-date medical and scientific data. Approval has been carefully considered, with safety as the key priority here. Provisional approval is just the first step in the process, however. Cabinet will now weigh up all of the options on the best use of the Janssen vaccine as part of our nationwide program, following further advice from our team of officials. So we can expect a cabinet decision on the decision to use should be expected sometime in August. Many New Zealanders might be asking what the Janssen vaccine approval means for the existing rollout of the Pfizer vaccine that's currently underway. The medical evidence shows that Janssen is a very safe and very effective vaccine, and therefore it is a good vaccine to add to our options. But our plan remains to ramp up and roll out the Pfizer vaccine from here, recognising that we have an additional option of the Janssen vaccine, which will increase our choices and our flexibility in the future once it has arrived in New Zealand, should we need to do that. As a single-dose vaccine, it may be useful for hard-to-reach locations, for emergency situations where we need to scale up our vaccine in a particular delivery in a particular area very quickly, and also for those who cannot have the Pfizer vaccine, which could be a very small number of people. It will be there as an option. Before I hand over to the Director General for today's update, a couple of other quick issues. In terms of District Health Board's plans, the next few weeks of DHB plans for the vaccine rollout are being added to the Ministry of Health website today. and we are just finalising the model for the next few months, and we will release that once that has been finalised. The Prime Minister spoke last month about the measures that we're putting in place to ensure that we reach all those we need to in a timely way, and that includes workplace vaccinations. By the end of this week, the Ministry of Health will be seeking expressions of interest from employers who have large workforces and they want to do some on-site vaccinations for their workers. That process has already been set out for them, and the expressions of interest will start coming in this week. Some of New Zealand's biggest companies have already expressed a keen interest to be involved in that, and I really want to thank them for backing that program. Supporting their most valued assets, which are their people, to get vaccinated is certainly something that we welcome. So in closing, I want to acknowledge last Friday's announcement around the expansion of New Zealand's vaccinator workforce. We have changed the medicines regulations to allow more health workers to be trained to give vaccinations, to lend a hand as we do what is the biggest vaccination program we've ever done in New Zealand's history. So a thank you and a welcome to our retired nurses, people who have trained overseas but aren't yet registered here, our kaiawhina workforce, and those others in the healthcare assistant workforce who are signing up to contribute to our vaccination efforts. A big thank you to them, and particularly acknowledge the contributions of Māori and Pacific vaccinators who are going to be joining the program. We know just how important that is. This influx of health workers will boast these numbers and, of course, the diversity of the workforce, and we very much welcome that. So I'll now hand over to the Director General, and then we'll open up for questions.
Thank you, Minister. Kia ora koutou katoa. So an update on latest progress with the rollout of the vaccination program, a brief update also on the Mariners situation, and also a comment on the work of our Healthline teams across the motu. Is what I'll focus on today. But first, just to report there are no positive COVID-19 cases in the community. There are 5 cases associated with the border, 3 in recent returnees in managed isolation facilities, and 2, which you're aware of, who are isolating on board a ship offshore. Yesterday there were 7,255 tests, and all our other regularly reported numbers will be in today's statement from the Ministry. So as the program scales up, as the Minister has said, so too does the workforce behind it, and a huge amount of work has gone in behind the scenes. We are now approaching around 9,000 trained vaccinators to support the program across the country. These people obviously play a crucial role in ensuring the vaccine continues to move swiftly from our call stores, as it were, into the arms of New Zealanders. It's been very encouraging to see people from a huge range of both registered professions and also in that now those unregistered professions or people who have left the workforce who are able, under the change to the medicines regulations, to vaccinate as well. I'm pleased to also report that all DHBs are now using the Book My Vaccine tool to manage their vaccination bookings. And there are already more than 325,000 future bookings in the system at more than 100 vaccination centres around the motu. The tool will go live for people in Group 4 from 28 July with the eligibility to book phased over time according to age bands, as has already been publicised. Once someone is eligible, they will be able to book an appointment at any time. An update on our Mariners. Today I can confirm that all 3 close contacts of those Mariners who tested positive for COVID-19 after arriving in New Zealand on Monday are fully vaccinated. That is the 3 contacts. They are the bus driver who drove the crew of 9 from Auckland to New Plymouth, a port pilot and a customs officer. All 3 were wearing appropriate PPE when they interacted with the Mariners. In the case of the bus driver, that person wore an N95 mask for the entire journey. The bus driver has gone into an Auckland managed isolation facility to undergo the 14-day period of isolation, while the port pilot and customs officer are self-isolating. They are being tested today. Now, the Mariners arrived aboard a red flight, which means everyone else on that flight is in fact in a managed isolation facility for 14 days. All those people from that flight have tested negative already, and as part of their process in a managed isolation facility, they will of course receive day 3, day 12 tests. The remaining 7 of the 9 mariners who are also on board the vessel have returned negative results, and all of them, all 9 of course, complied with full infection prevention control protocols, including wearing masks during their transport from Auckland Airport to the New Plymouth port. We're doing whole genome sequencing just to get an idea of what variant the 2 infected people have. The ship has been at sea, and I understand it is now returning to the port at Taranaki, and my understanding is that all crew on board will be moved to a managed isolation facility and will remain there and be tested as part of the usual protocols. As has been said before, we continue to regard this situation as a low risk to public health. There are very strict protocols around these transfers, and I asked the team to check. Since November last year, over 1,100 mariners have been moved through the airport and off to ports in the country and onto vessels through this very strict protocol. So that was the same protocol that was being followed in this place. And finally, I would just like to give a shout out to our Healthline teams across the motu. Last week, they received their 2 millionth call since February 2020, and 97% of those calls were answered within 10 minutes, an extraordinary achievement. The Healthline service has been serving New Zealanders for more than 2 decades now, and through the pandemic, that includes through the pandemic, the Christchurch terror attack, other national disasters, and of course, the increase in demand we see with the annual flu season. It's proven how vital it is as part of our country's healthcare system. In addition to the usual Healthline service, there are 3 key new services that support the overall government COVID-19 response. There is the COVID-19 Healthline, the COVID-19 welfare team, and shortly there is going to be, of course, the dedicated COVID-19 vaccination Healthline, which will have 1,000 people trained to support it. And in the past year, of course, the Healthline teams have needed to respond at times to a number of significant spikes in demand, particularly when we have a community case. They are continuously planning, modelling and forecasting to ensure they can have the right workforce available at the right time. And I do want to thank that workforce again, and I think we're very fortunate as a country to have them supporting us. Back to you, Minister.
Thank you. We'll open up. Mighty.
In terms of the Janssen vaccine, what do you say to New Zealanders who may be a little bit hesitant about that vaccine?
At this point, we haven't made a decision whether to use that vaccine or when to use that vaccine, so there's still there are further steps in the process. The MedSafe approval, as I said, is the first step in the process. They've certified that it is a safe and effective vaccine. Whether and how we use it is still a decision that's yet to be made.
The World Health Organization says that Pfizer has a 95% effectiveness when it comes to COVID-19, and Janssen is 66.9% effective. What do you make of that comparison?
I think one of the key things to remember here is that we're not always talking about like-for-like comparisons. So each of the vaccines have been through a different set of trials, typically run by the people who have developed those vaccines. And so they're not replicating exactly the same conditions for each of those trials. Some vaccines are weighed against different variants of the virus, for example, and in different circumstances, different population cohorts, etc. We know it's an effective vaccine. We know that Pfizer is an incredibly effective vaccine, and so we are continuing to roll out the Pfizer vaccine. As I've indicated, we have not yet made any decisions about when we would use the Janssen vaccine.
What about this portfolio of vaccines and this portfolio of vaccines, and we now know you've got the Janssen and there's the Pfizer. What other vaccines were in this portfolio that you've been talking about?
So we've had, I think it's well known, they were released last year. We've also got AstraZeneca, and that's still in its approval process. And we have been, we will be donating a significant portion of our AstraZeneca purchase to other countries, particularly around the Pacific, who have asked New Zealand for that particular vaccine. So you can expect to see us taking delivery and shipping out almost straight away good quantities of AstraZeneca to those countries where we can assist them. We've also got another one called Novavax, which has not yet been approved for use in New Zealand. It's a further way off. We're not expecting that now until next year at the earliest.
How much do you pay for Novavax?
We haven't released how much we've paid for any of them.
Okay.
Yes.
Are you donating AstraZeneca basically because it's like the poor cousin of the vaccine, so there's problems with boycotting?
Not at all. We are working with countries to try and help supply them with the vaccines that they are using and that they're asking for. So Fiji, for example, are well down the road to rolling out the AstraZeneca vaccine, as are Samoa and Tonga, I believe. They're already using that particular vaccine. The Cook Islands and Niue and Tokelau, who we've been working with, have indicated they'd prefer to use the Pfizer vaccine. So we're working with them to get supplies of the Pfizer vaccine.
On the Janssen one, there seems to be some indication that it's less effective on the Delta variant, and there's a lot of talk overseas about using the Pfizer or Moderna to boost the usefulness of the Janssen. Do you received any preliminary evidence of that, and how is that factoring into what you're thinking?
So there are studies underway on all vaccines to look at what their responsiveness is to the Delta variant, both lab studies but also gathering of data about the efficacy or the effectiveness actually in countries where they've been rolled out quite extensively. What I would say is very promising data around the Pfizer vaccine. So I think the figure I saw was about 88% efficacy against the Delta variant. There's no doubt there is a difference from the trials in the efficacy across the different vaccines. And one thing seems to be clear, that the mRNA vaccines, so the Pfizer and the Moderna vaccines, seem to have the best efficacy profile, and that's been borne out, I think, in the data from the real-world data from countries. Hence, our sticking with our existing program. But these are the sorts of issues we will be asking the technical advisory group for advice around, which is effectively under what sort of circumstances would they recommend that the Janssen vaccine, or indeed the AstraZeneca and in time the Novavax vaccine, would be appropriate to use those in the New Zealand setting, and that advice will be what I think that advice will inform Cabinet's decision.
Do you have advice about the Delta variant in the Janssen vaccine specifically so far?
That will be the technical advisory group will gather up all the relevant published data in making its recommendations about, again, the circumstances when or when we would use that vaccine.
Gina.
Dr. Bloomfield, is the Ministry of Health concerned about this sharp surge in RSV cases overwhelming hospitals?
Well, certainly concerned about the sharp surge in RSV cases. This is a nasty illness, and for young babies, it's very debilitating and it makes them very sick. It is a classic thing that happens every winter, a bit like the flu peak. Now, once again, this year, as happened last year, we're not seeing that rise in flu cases. However, we had very little RSV last year, and this year we are seeing the usual increase that we had seen previously, and there's some speculation that may partly be exacerbated by the fact we didn't have any last year, and so there is a bigger pool of children who are susceptible to it. It is always a challenge for our hospitals to deal with this in winter.
Parents are telling us that they had no idea about the virus. Parents are telling us they had no idea about that virus. Is there enough information about it?
Look, I think babies and children suffer from a whole range of illnesses, and often there's not discussion about a particular virus, but certainly RSV is one that's common. It's more common that Māori and Pacifica children get sick with RSV during the winter. So if there is a sense that perhaps there should be more information out there, we'd be happy to do that. I dare say that if parents ring Healthline or Plunket Line, they will get very good advice about what to do if they have a sick child.
What advice are you giving hospitals to prevent the spread of RSV?
I'm not personally giving them advice. They have very good infection prevention control processes in place that they will be employing even as they do get a lot of cases.
Why is the vaccine rollout so slow in Canterbury? It seems that Group 4 has been pushed right back till September.
Look, we'll be working with Canterbury over the next few days as we finalise the rollout plan for the next quarter, or for this quarter if you like, now that we've got some more certainty as to sort of what kind of quantities of vaccine we're expecting to be delivered. We'll be working with all of the DHBs to refine the plan, but our expectation is that DHBs will be rolling out the vaccine as part of a nationwide rollout of the vaccine. And that does mean that we'll be working with DHBs to ensure that they are aligning their timing when it comes to the priority groups.
So have they been overly cautious in what they're been saying so far?
Look, like I said, the teams will be working with each of the DHBs to make sure that they are working to a nationally consistent plan. We want everyone across the country, all of the DHBs across the country, to be working to a nationally consistent plan so that New Zealanders know what to expect. And we'll be working with each of those DHBs in the next few weeks, or the next few days really, to sort of lock down that schedule for the next couple of months.
Friends won't have to wait longer than anyone else.
Look, like I said, we're working to a nationally consistent plan, and that includes Canterbury. Canterbury is still part of New Zealand. Up the back there.
On the Mariner situation, is it time to review the policy where the Port of Auckland don't allow mariners to go sign into their own port facility to drive them across the country? Does this incident show that that's quite risky?
So we've got some pretty robust infection prevention and control measures to allow for speedy crew changes for those foreign flagged vessels that might be in port in New Zealand doing a quick crew change and then leaving again, where 14 days of managed isolation or quarantine in New Zealand simply isn't a practical option. We are simply being the port, if you like, the airport that they are coming through in order to arrive here, get on a ship and leave again. As the Director General's outlined, we've got some pretty robust measures in place to make sure that that bubble that they are in during that transit period is very tight. And so that if anything does happen, as we've seen in the last 2 days, we know exactly who they've been in contact with. We've put as much of a layer of protection around that as possible. All of the workers concerned here were fully vaccinated, which again helps. And then we can do contact tracing if you need to. Previously, and you may recall several, going back a wee while now, this was happening without necessarily keeping as good a records of the movement of these people, because they literally are just, they're in and then they're straight out again. We are now testing them routinely so that we can pick up cases like this. Again, we're one of the only places that is being that rigorous, where someone who barely even, sets foot in New Zealand is being tested on their way through. Just because it adds that extra layer of protection to us, it means that we've got that extra layer of assurance, that extra layer of information if we need it.
The Mariners, just on the Mariners.
Why has Canterbury indicated that it's not part of this nationally consistent plan?
Look, DHBs do from time to time, have from time to time departed from the national messages that they have been asked to use around the vaccine rollout, and we'll be working with them to ensure that they stick to a nationally consistent framework.
This plan though, right? They're basically saying here that they're not going to be able to meet the timeframes that you are setting out here at the podium, correct?
Look, I'm not going to get into every one of those discussions with each individual DHB. I'm not the one having those discussions. The government's expectation is that all of the DHBs will be working to a nationally consistent plan in the rollout of the vaccine.
Why are you having to go back to them and talk to them about this?
Look, some of the messages that Canterbury are putting out have not been aligned with the plan, and that's why we are continuing to talk to them about that. Claire?
Can you explain on what basis you said yesterday that worker reluctance might be behind the low uptake of the saliva testing option? Because we've gone to people in the unions who say that we're quite surprised to hear that.
Yeah, so what we've seen in sites where it is available, and it is only a limited number of sites where it is available, the uptake has not been particularly great, and the numbers will bear that out. Having said that, that doesn't mean that those numbers are going to stay that way as the number of sites that it's available at expands, and I want to see the number of sites that it's available at expanding quite rapidly. And so I've been working with the Ministry of Health team to make sure that that expectation is clear, and I hope to have more to say about that soon.
On what basis did you say it was reluctant?
Because that's the feedback that we've been getting from the teams who are rolling it out.
Question for Dr. Bloomfield, if I could. There are 27 new cases in New South Wales today. 9 of those have yet to be linked to the Bondi cluster. Is this situation deteriorating? And what's a realistic time frame that you would recommend going back to the green zone for New South Wales?
Well, I can't really comment on the latter. I don't think the situation is deteriorating, but I think it's still very much in play, and that will be what's behind the extension of their current restrictions on movement and other sort of expectations of their population. It's quite clear that there's been quite a lot of spread, but what is also clear is that they are identifying, they know who the close contacts are, they've got those people in isolation, and they're identifying cases quickly because they've still got high rates of testing, and then they're able to isolate those.
I wanted to ask you about the UK's move to remove restrictions, with the Health Secretary saying that they could be up to 100,000 new cases a day. Are you fearful of that? Do you fear it could lead to new variants and ramifications for New Zealand?
Well, I think we, like everyone, will be watching very closely, and what it will also mean, of course, is it will, if they do get an increase in cases, we will be keeping a close eye on what that means for the risk of people travelling from the UK, and that will inform our decisions here around how we might deal with travellers coming from the UK.
Are you suggesting they could be put on the same block list that India previously has been?
We actually review the risk status of all countries each week, so that clearly if there is an increase in the number of cases, that's one of the things we'd be watching very closely.
I was just going to say, there's 1,000 rooms that are currently empty in MIQ for various reasons, and there are 0 available vouchers for the next 4 months. Is that an acceptable situation?
So if you look at MIQ, we have a contingency that we have to maintain. We've also then got a larger contingency that we put in place for the Trans-Tasman bubble. We are in the process of reviewing that now as to whether or not, as we understand more about how the Trans-Tasman bubble operates and how we manage any disruption to the bubble, we're looking at whether we need to have that 500-room contingency there available, and I hope to have more to say on that by early next week. And if we can re-release those rooms back into the system, then that's something that we will consider. We also have had a couple of facilities, the Grand Millennium and the Grand Mercure, that have been out of circulation because we've been doing some more intensive work, particularly around their ventilation systems, but also they've been used pretty intensively for over a year now, and hotels do reach that point where they need to have a bit of maintenance work done on them, so that maintenance work has been being done. So we are releasing the vouchers that are available. I do want to say there are a couple of things here that complicate this picture a little bit more. One is that there's the nature of short-term no-show cancellations. Often by the time people don't show up, if they've made a booking, it's too late to then release that room to make it available for someone else, because it may only have, say, 13 days of the 14 required days left before someone else is booked in to occupy that space. And so that creates a bit of a challenge for us, and we do see that. Short notice flight cancellations can particularly exacerbate that, and anyone who's following international airline schedules around the world will see that schedules are changing really rapidly at very short notice, and that does disrupt MIQ bookings. So we're seeing about 5 to 7% of rooms where there's some disruption to the people who had been planning to occupy them because of those other international factors that are beyond New Zealand's control. So we will look at whether we can increase the number of vouchers available, potentially nudging into the contingency at a very modest level if we got a higher uptake rate than we had anticipated. So those are all the sorts of bits of modelling that we're doing. Ultimately, I don't want us to have rooms empty that could be being occupied by people. But we have seen the demand pattern shift really dramatically in the last couple of weeks. So we went from a period where there were rooms available to anyone who wanted them to a point where now bookings are very tight. There is high demand.
It's part of this, though, by design, and I look back at the data. Around Christmas, we had about 7,500 people in MIQ at any time. Right now, we're down to about 2,900 filled rooms, 4,000 rooms in total. Did the government go a little too far by taking facilities offline?
No, they've only been temporarily taken offline. Very few will be, none that we've announced so far, other than the Ramada, have come offline completely. Others are having work done on them and so on. And we did want to do that during the quiet period. And we were quite open about the fact that while there was a quieter period, we would take the opportunity to do that, far rather do that when there's less demand than when demand is at its peak. So we have done that. We have made other changes that, though, have impacted on room allocation. Cohorting builds in an inefficiency into the system in terms of maximising room usage, but actually for the public health benefits, it's been a trade-off that's been worth making.
On the Mariners, were there any unscheduled stops along the way from Auckland to New Plymouth? Did the driver stop to refuel or anything like that?
No, there was one scheduled stop, a toilet stop, and that's at a dedicated facility in Hamilton that only those who are in transit to these, either to ports or to the facility in MI facility in the Rotorua can use. Members of the public can't use that facility, and it's deep cleaned between each group that uses it.
Just follow up on Ben's question before about the UK's decision. What was your reaction when you heard the Prime Minister of the UK saying that we're going to have to accept some more deaths over here?
Well, look, I think right from the start of the pandemic, countries have chosen a pathway, and New Zealand chose its pathway, and other countries chose a similar pathway. Countries have taken a range of approaches based on their view of the scientific evidence, what their current circumstances are. And one of the things we've always remained open to is seeing what is happening in other countries that are taking different approaches so that we can learn from that.
Just in honour of our absent friend, is there any update on that tail end of border workers who remained unvaccinated? I think it was around 1,600 still to go last week.
Yes, further work's being done on that. There's still some NHI matching issues there, where as we've gone through sort of line by line, person by person, to investigate whether or not they've been vaccinated. Some have been vaccinated, but their vaccination record hasn't been pulled through into the system. I can get you the actual numbers. I just don't have them with me. But progress is being made there. There's still a group that we're still chasing down. But data matching does appear to be a bit of an issue there for some of them.
Just on behalf of the colleague, given it's such a big team, does the government have any concerns about sending our athletes to the Olympics when there could be an outbreak?
Look, it's ultimately not something that I have considered in the last few days. I know that there's a lot of very rigorous protection measures being put in place for the Olympics and around those who are travelling to and from the Olympics as well. But I'm not in a position to give a more detailed comment on that at the moment.
Is there a contingency plan in place?
All of our Olympians, when they return back to New Zealand, will do the full 2 weeks in managed isolation to ensure that if they have at some point been exposed to COVID-19, they're not bringing it back into the country with them. But there is an element, as there is for anyone leaving New Zealand at the moment, for any port travel to anywhere, there has to be an element of traveller beware here. The world is not as safe as New Zealand is at the moment when it comes to COVID-19.
Talk about the Janssen vaccine possibly being used in an emergency situation where we needed to scale up. Can you just give us an idea of what that situation might look like and when you would hit the go button on that?
Look, I think if we were dealing with a large-scale outbreak, for example, or an outbreak that was accelerating in size, where we wanted to really scale up our vaccination in a particular area, then having an extra option is a handy thing to have. But at this point, it's kind of a hypothetical. It is an extra layer of assurance, an extra layer of comfort for us to know that we've got choices there in the event that we needed to use them. But I'll invite the Director General to comment on that as well.
I think the two situations where it might be particularly useful are that one, where we really want to vaccinate a lot of people urgently. The second is it's good to have an insurance policy in case there is some sort of disruption to the manufacture of Pfizer. And there's a big disruption to that supply, and to have a second vaccine available would be very helpful.
Have you thought about how you approach resistance, perhaps, from people who look at the Janssen vaccine and say, look, I want the gold standard, I want Pfizer, I don't want Janssen. Have you thought about how you'd approach that if people were sort of holding out and not wanting that Janssen, if it did come onto the floor?
Well, I think that would be an issue we would need to deal with. One of the things I would say is that all three of the vaccines that have either been provisionally approved here or are in the process, and we don't yet have all the final data from the Novavax trials, but the early data are very promising, efficacy up at around 90%. So personally, I would be happy to have any of those three vaccines. They are comparatively very effective and very safe vaccines. If we needed to deploy the Janssen vaccine, we would of course make sure we were doing so with really good information available to people about the benefits and risks profile, so that people could make that choice for themselves. At the moment, we're in the very good position where we have a Pfizer-based program and higher level of confidence in the supply of that vaccine.
Okay, we will start to wrap up soon. But
have you provided advice to Cabinet yet on Pfizer use for 12 to 15-year-olds?
We have got the approval from MedSafe, obviously, for that, and I'm just getting the final technical advice from our technical advisory group, in particular just to look at if there are any issues emerging from the use of this vaccine, not just in the 12 to 15-year age group, but in younger age groups around the world, and that will form our advice to Cabinet, which will be probably later this month.
It seems to be overseas fine?
Yes, a number of countries are rolling it out. I dare say one of the things that countries that have used this in younger people have found, and I would say Israel and the US have found some reports of myocarditis, particularly in young men under 30. It tends to be mild and self-limiting, but that's emergent evidence, and we're in a position where we can afford to have a good look at that evidence, so that if Cabinet makes the decision to roll it out here, we can make sure there is appropriate information for people to make a good decision.
We'll make it right at the back.
Where have you got in on pre-departure tests for the Trans-Tasman bubble? Is that looking like it's going to be a permanent feature?
It's certainly in place for the foreseeable future. We'll keep that under review, but those who are planning to travel from Australia to New Zealand in the foreseeable future should plan to get a pre-departure test. Look, I wouldn't go that far ahead at this point. We'll keep it under review, but certainly in the immediate future, people should be thinking about planning to get their pre-departure test before they travel.
On those tests, what do you think a reasonable price to pay to travel will be?
Most people should be able to get a test for a couple of $100.
And do you think that's reasonable for holidaymakers or families that are separated to spend?
I think the reality is that travelling around the world at the moment, wherever you're travelling, is more expensive and more uncertain than it ever has been in any of our lifetimes, and that is just one of the realities of the way the world is at the moment.
Yeah. What nationality the mariners are?
My understanding is that the shipping company has described them as from Southeast Asia, and so I'll stick with that description. Thank you. Yeah.
The AstraZeneca vaccine, have you considered changing the policy so that you can just make that available to the Pacific now before it's approved in New Zealand? Because the time that Fiji needs it would be...
Unfortunately, that's not our decision to make. So ultimately, the manufacturer still requires that we have approved it before they will deliver any to us in order to allow us to deliver it to the Pacific. What I can say is we're working closely with Australia, who have AstraZeneca approved, and so they have been helping to keep particularly Fiji stocked with vaccines while we finish our approval process here, so that we can then forward on our donations. But Australia and New Zealand have been working very closely together in our support for Fiji, recognising the very difficult position that they find themselves in at the moment. And our thoughts are obviously with everyone in Fiji. It is a really difficult time for them.
Couldn't you just cede it to Australia and have them take...
Again, unfortunately, we have looked at all of those options. We want to get out the vaccines up to Fiji as fast as we can. Unfortunately, we're constrained. The constraints are not at the New Zealand end. I'll be really clear about that. So the constraints are in terms of the conditions that AstraZeneca place on deliveries, and so we're working really hard to find every way that we possibly can to speed up deliveries. The fastest way we've got at the moment is to work with other countries that have got approval, particularly Australia, and have them helping to plug the gap in the meantime, which they are, and acknowledge Australia for their work there. Because, of course, Australia are not just supporting Fiji, they're supporting a number of other countries in the Pacific as well. We will wrap up shortly, so we'll sort of come a bit of a loop just to finish up.
Mine's unrelated.
Okay.
What's the hold up with getting approval for the AstraZeneca, and is it disappointing that Janssen has moved faster in the process?
So the key hold-up is with manufacturing data, which MedSafe is still waiting for. They are pushing hard for that and expecting to have it in time for a meeting of the Medicines Assessment Committee next week. And we've made sure that all our processes, following that consideration, if the decision is made for provisional approval, all our processes after that are lined up ready to go so that we can get advice through to Cabinet quickly on that. It could receive the provisional approval from MedSafe as early as next week, and then there would be a number of other things we would need to do. But once that provisional approval is there, then the manufacturer can give us an indication of when it can be delivered.
Okay. Third to last question here, and then we'll finish with you two up there.
Just on the sense of talking about speed and urgency here, when do you think the soonest that Janssen could be in arms in Kiwis, and do you not feel a sense of urgency about getting a decision out the door sooner than August on this?
At this point, I don't have a confirmed delivery date for when we could expect to receive some deliveries. That's typically not confirmed until after approval has been confirmed. So now that approval is there, we'll get a bit more of an indication of when we might be able to receive some vaccines. But if they would, I wouldn't be expecting them to arrive until at least sort of late August at the absolute earliest. But if that was to happen sooner, then we could move sooner if there was a need to.
So I just have another question about RSV. Forgive me if I misunderstood you, but I think you said it was perhaps more prevalent this year because more children may be more susceptible to it. Is that because they haven't been exposed to viruses over the Could you maybe explain?
Yes,
why?
so there's been some speculation that there may be a bigger pool of susceptible children because last year the group of children generally under sort of 3 years of age who get sick with RSV, it's particularly bad in young babies, that group was spared it because of the lockdowns. We had a number of viruses where we didn't see those usual winter peaks. Interesting, this year we have got that winter peak, and there is some speculation that because there's a bigger pool of children that there might be higher rates of it this year, but the size of the surge and peak in our hospitals is about what we see each year.
The Queensland numbers are out. It's 1 new case in home isolation the entire time, alpha variant. So is that enough to open the bubble?
Expecting advice from my team this afternoon, which I will be looking at and then passing through to the Minister to make decisions about that.
We will let you know before the close of play today. It'll be probably quite late in the day, but we will let you know decisions around Queensland. We'll let you know later in the day. Thanks, everybody.